This is The Healthy Healer, where true voice is your medicine. This is where we help doctors and other healers navigate through the challenging times by learning from the best minds in the healing industry. Laugh, cry, and be surprised. It's entertainment, education, and inspiration so you can continue to be the unique and amazing healer you were destined to be. Welcome to humanity. Welcome to The Healthy Healer with Dr. Fred.
Hello, everybody. It's Dr. Fred, and welcome to another amazing episode of The Healthy Healer. And today, I really do have a massive honor. I know I say that every week, but today it really is a massive honor because the man that I'm accompanying with tonight, the man that I'm interviewing and introducing you to, is somebody who I've known for several years this time. Now, we took a few years off. We weren't talking all that much. We knew a little bit about what each other was doing. He's a friend of mine from Cincinnati. He knows everybody I knew in Cincinnati, and I knew everybody he knew in Cincinnati. We spent holidays and trips together. We took a bunch of bike rides together. We did a lot of golfing together. We had a lot of Shabbat dinners together. We've done a whole lot of things together over time. Probably been together. I remember the first time that we met even. Maybe we could talk a little bit about that. But it had a little bit to do with Jimmy Page and Robert Plant, as I recall.
Oh, my God.
That's it.
That is
Exactly
one of my
how we met.
fondest, that one and the camping trip with the kids are two of my fondest memories.
Yeah.
I had never done that in my life. Gotten on a plane and gone to a concert.
That was really. Oh, that was the Who. We did the Who, actually. We did Quadrophenia in Madison Square Gardens as well.
Yes.
So this is a rock star, a true rock star, and a friend of mine, an amazing physician, an amazing healer. And without further ado, I want to introduce you all to Hal Blatman. Hal, thank you so much for being on The Healthy Healer.
Fred, I'm so glad to be here and so glad we reconnected.
Thank you. Yeah, it's really beautiful. So, yeah, some of the things that we did early on to meet, I think we actually met in Cincinnati when I think Dave gave us tickets for that, for Plant and Page together. And then realizing that we were doctors who were rock stars at the same time, we set up to go to Madison Square Gardens and saw Quadrophenia perform live by The Who, which is absolutely ridiculous.
From the back row.
From the back row. Really unbelievable show. Super fun. So, Hal, what are you up to these days? Some of the things I like to ask my guests, I have a particular question that I like to ask a lot of guests, but for you, it doesn't really fit. So it's a 9-letter question. It's a profound question that is grammatically correct and only has 9 letters in it. And so the question is, and in this case, it would be 12 letters. Hal, who are you?
Wow, that's pretty cool to have just those letters. It's an interesting way to reflect. We've both been around quite a while, and whoever I've turned out to be, I really like him.
That's beautiful.
I'm proud of him. I think he's done well by people, and I think he's got a lot of work left to do, speaking in third person about myself, turning outside and looking in or looking at, and I'm glad. I like what I see. I am all about helping people get out of pain and see the truth, and in the process, hopefully, be able to change medicine and keep so many people from suffering that they don't need to suffer.
That's unbelievable, beautiful, and that is how I know you. Talk to me about this idea of seeing the truth, Dr. Blatman.
There's so much of what we have seen that doesn't turn out to be true. There's so much of what we've learned that what we've learned isn't the way our world works or the way our body works. And I've gotten to see medicine from that side, and so much of medicine is not what we were taught. You've learned so much of psychiatry is not what we were taught. And I've learned that nothing can be more true than with pain. Pain is so much not what we were taught. And it's not that what we were taught is wrong. It's that most of what we were taught is not even relevant to what causes pain or what it takes to really make it go away. We've taken a sidebar, and sure, the things we've learned are real. A knee is a knee, kneecap is a kneecap. All things move the way they move, but pain doesn't come from disc and spine and nerve, or even inflammation as we were taught. And as you go to a doctor to talk about your pain, sooner or later, hopefully, if you have pain long enough and you go from professional to professional, provider to provider, at some point you start to realize that none of the people you've seen really know what they're talking about.
Oh,
And you go on with pain, you take medicine, and then my colleagues, those in pain medicine, they do things that maim people in the fake of medicine. We kill nerves, we kill muscle, we call it radio ablation. We put massive doses of steroids in people's spines, and these are poor, desperate people who hurt. We offer them surgery with a 50% chance of success. And they're desperate enough to do it because nothing else they've done has worked. And some of what they do helps for a short time, some helps a little for a long time, but none of it really makes it go away. Partly because none of it really addresses the problem that causes the pain or sees the injuries. I have a patient who's a above-the-knee amputee. We're all taught that phantom limb pain is central, comes from your head. It has nothing to do with your head. Phantom limb pain has to do with the residual limb and the fascia that's retained that was traumatized during the event that still sends pain to the foot. Doesn't care there's no foot there. And all you've got to do is help the fascia repair, and that pain goes away. It's amazing how quickly pain can go away and how everybody can do it with their hands and how people can see it and it can be figured out. And it's not easy and simple, but it's fairly straightforward to understand. So I've defined pain into 5 rules that seem to stand the test of time, that help elucidate where it all comes from, and none of it is what we were taught.
Let's hear them, of course. We can't bated breath.
So rule number 1, you can't believe the pain comes from where you feel it. Your headache doesn't come from your head, and contrary to what we're taught, not your blood vessels and not your nerves. And don't they tell us the pain in our left arm could be a heart attack? And talk to your friends who've had their knee replaced, and how many does the knee still hurt? And the pain never did come and still doesn't come from the joint. Interesting thought, right?
Fantastic.
Rule number 2, it's not important what we think pain feels like. Our brain can't tell the difference between numbness, tingling, burning, itch, tickle, sharp, dull, achy, stabbing, and interestingly enough, to some extent, not even sexual arousal. Can we talk about that?
Of course.
So if Mike Tyson bites your ear off, everybody knows that's going to hurt, right? Your honey touches your ear, you have a much different reaction through your entire biology. And then you find out it doesn't even have to be your ear. Same skin, same nerves, goes the same part of your brain as the pain. Rule number 3, at the end of the day, the only thing you can really believe is what you can touch and feel. It's really hard to beat that, right?
Yeah.
But the most important part of your exam is where specifically are you tender, millimeter by millimeter? Because the only places in your body that are tender, unless you beat on something and make a bruise, the only places that are tender are where the strings of fascia that go through you and hold you together are kinked and tied in a knot that many of us have called a trigger point, or where they weave and anchor and hold you together, and you've injured and repaired them hundreds of times. That's the only places you're tender when you push. Rule number 4, if I examine you that way, from head to toe, the places where your body is overall most tender represent those kinks and injuries through your lifetime that generate most of the pain of which you are conscious. And rule number 5, better than 90% of the time, no matter how long you've had the pain, and no matter what you think is your diagnosis, as quickly as you unkink those strings at where you need to, strengthen how you anchor and hold together so the next time you pull, you stay together. As soon as you do that, the pain that you had is already gone. No matter how long you've had it, no matter what's your diagnosis, almost all the time. And those 5 rules have nothing to do with your spine, your disc, your nerve, whether something's out of balance, whether it's in balance, whether you're compensating for this or compensating for that. And God knows all the other things that we've heard that all have some element of truth, but at the end of the day, compared to what's really going on, they all belong in the horse poop drawer. Because 80% of the information that comes to our brain from our periphery are the nerve endings in between these strings that get torqued and twisted when these get torqued and twisted, that are in the middle of this kink or where that kink is caused.
Of course, it's totally brilliant, Hal. I totally appreciate it. And of course, I've been a patient of yours as well and had some amazing trigger point injections that have cured me of pain instantaneously. I want you to speak a little bit to number 5 again, the 90% of the time one, the idea that the pain. Can you say what you said again with number 5?
Yeah. Let's expand on that, because everybody who's watching this can touch it and feel it in their own body. And it's really simple. There's a muscle right here in your neck. It's about the size of your thumb. You can grab hold of it, face straight ahead. You can get your fingers around it, and you can pinch it, and you can feel there's ropes and cords in this muscle. And somewhere between the back of your head and your collarbone, they're surprisingly tender. Wouldn't you agree? And then touch the top of your collarbone, push down on it, run your finger across the top. You'll feel little irregularities that are also surprisingly tender.
Yeah.
This on your collarbone is the injury that causes the strings to kink in your neck. And the first time you got that injury, you were an infant, and somebody picked you up by your shoulders, forgot to bring your head. Another time, you were on the playground and some little kid came up behind you, shoved you to the ground, snapped your head back, and tore where the strings and cords that go through this muscle weave and anchor, that anchor I was talking about, through the cover over your collarbone before they come down into your chest. Take your hand, get a big bite of your pec muscle, run your thumb across that, and feel the ropes and cords in there and how tender that is.
Yeah.
Those are the injuries that you got the first time when you got up off that playground floor and pushed that little kid back. And then you can think of hundreds of times, like when you did planks in the gym or when you did too many push-ups in 10th grade, and the list goes on and on. This injury makes these kinks, and these kinks make a pain pattern that you identify as migraine and something we call trigeminal neuralgia. It doesn't come from your head. And if you grab hold of these where they're tender and you give them a firm, gradually increased pressure, you'll feel pain go up to your eye and across your forehead as you do that. And all you've got to do to make that pain go away is unkink these strings. You have this ropey band across your upper shoulders. Everybody's got that, right? You squeeze on it, it hurts. You know what we're talking about with the soreness in the upper shoulders, and you get massaged and they feel better. The reason these muscles are tight is the same thing. You're strong enough to contract this muscle to lift and carry your book bag. Yeah, it goes all the way back to then. Carry your suitcase, your briefcase, take out the garbage, hold up the world, right? But where the muscle anchors peripherally and centrally isn't strong enough to hold you together when you pull that hard. You tear from all 4 ends, 2 on each side, and twist into these. That's why they're tight. The reason they're really tender and glued together on the inside is what your immune system does to light up the injuries of a lifetime for 3 to 5 weeks when you have the smallest, slightest amount of dairy from cow. So the sum of your pain is the injuries of a lifetime compounded with what your immune system is doing in reaction to inflammatory things in your food and environment that cause things that we should never be exposed to. So we minimize the exposure. We show you another way to eat if that's important and necessary. And we show you how to unkink these strings. And then we help you unkink them from the inside and heal how you anchor and hold together so that the next time you pull, you don't kink and hurt again. Here's another one that's really fun. Have you ever noticed that men lose their butt when they get older?
Yeah.
It's not just because it gets chomped on by their boss It's not just because it gets chomped on by people that love them and whoever that goes, including their kids, because everybody takes a piece out of dad.
Mhm.
But there's a rule, and the rule is your body will not let you get strong enough to tear yourself apart from the inside. And so, how did men hurt themselves? Especially with the tendons that hold your butt together. When we were young, we jumped down the steps, and many of us can remember how many steps we could take in one jump because it was a badge of courage, and you were always challenged to take one more and then roll it out at the end if there wasn't a wall in the way. And then we jumped out of swings with an arc, and that wasn't enough. Many of us jumped off the roof, and I'm just talking about the first story. And when you land, there's two things we cannot defend in our biology. One is bullheadedness, that women call stupidity because it's mostly men who do it. And that's the guy who is way too old to curl this much weight, has to do one more rep and shreds his biceps, wanders around like Popeye forever. You can't defend that. And the other thing we can't defend is impact. And when we jump and we land, we tear the anchors just like this that hold our butt muscles to our body. And as we get older and that tissue becomes less resilient, our body actually atrophies our gluteal muscles, so we're not strong enough to tear our tendons without impact and bullheadedness.
Mm.
And that's why we lose the form. And if we help repair those anchors that we call tendons, and we make them stronger, if you're young enough, you'll actually regrow your butt. We've seen
Wow.
that happen. We've
Exciting.
actually seen that happen.
That's amazing. It's really awesome. So tell us a little bit, like these are not theories. These are, in your way of being, this is just simple truth at this point. When I said see the truth, these are some of the things that we should know as the truth, which are entirely different than what we learned in medical school or what most of our, we'll say, clients, patients, customers are learning from the people that they're showing up for it in an effort to get help with pain. Instead, what we're learning here is really what causes pain. And Hal, of course, it's entirely sensible what you're describing. It's based on a truth that far exceeds anything that is so complex that makes it into the journals. Instead, what we're talking here is simple human mechanical truth, like the natural physics of what we know to be real.
Pain is an engineering failure.
Exactly. And that's all we're really talking about. And how does that apply? What should a person know? Not everybody's going to be able to see Hal Blatman. So what can a person know on the pain that they're presently experiencing, or maybe even more importantly, how to preemptively protect themselves from feeling pain in the near future? And what can people do to prepare themselves for pain or else deal with pain that already is dominating their life?
We're working on that. And here's some things to start it out. Number one, you can go to our website, blatmanhealthandwellness.com, sign up for the newsletter, and get the Do Not Eat list. If you just follow the Do Not Eat list and take the inflammatory foods totally out of your diet, half your pain could go away like it never existed in the next 6 weeks. Could. We've seen better than that happen. But you have to understand that the word totally is really the important thing here, because people go, I'm mostly gluten-free. I don't eat much cheese. I don't eat much dairy. I only a little. Excuse me. This is an immune system issue. And if your immune system was sensitive to bee stings, how many would it take to kill you? Less than one. That's how much butter you get before your upper traps glue together for 4 weeks. The penalty is steep. And when your body makes you hurt, you got sent to your room. And now your job is to figure out what you did. Just look on the Do Not Eat list. It's right there, especially when you start out. And then figure out how long am I going to be there? And it's anywhere between 4 days and 4 weeks. A banana is going to make you hurt for 2 days.
Really?
A bite of mashed potato is going to make you hurt for 4 days.
Wow.
You want to feel good, you've got to make a deal with your lips. They don't let anything by that your eyeballs haven't read the label and your ears haven't heard the server go, that's okay, by your specifications. And you learn those specifications from the Do Not Eat list. Another thing is you can take a look at my book, Winner's Guide to Pain Relief. It's offered on our website. You can buy it from Amazon for $80, but we're a lot cheaper. I've actually seen it for way, way too much money. But the point is, the book shows the map of where are the kinks and where's the pain they cause, and how do you take a little rubber ball, push on those kinks, roll them out, and make them go away.
Mhm.
And one of the reasons you get a massage and you feel good is because you're unkinking yourself. And one of the reasons that pain comes back is you glued right back together again. And how fast you glued back together is more about your food than anything else.
Fascinating.
If you can tell me that last 3 or 4 weeks, you're great. If you tell me that by the next day all your pain is back again, or most of it's back again, take a look at that do not eat list. It's going to save you a lot of aggravation.
Now you mentioned,
Look,
yeah,
you
you
learn-
mentioned bananas and mashed potatoes and gluten. And what are some other surprise foods that probably most of America's eating that's getting them into trouble with pain?
You know, number one that really surprises people, I think, is dairy from cow. The cream you put in your coffee, you can't do it. And the artificial coffee creamer, you can't do that either. That's actually a poison.
Mhm.
So now you're into other substitutes. The best one we found is Laird's coconut creamer, and coconut cream in a can are the best things that we've found. But that takes a workaround. But to know that even the tiniest amount of butter will put your immune system in a tailspin. Ghee from grass-fed cows you can handle most likely, no matter how sensitive you are. And that'll give you the taste and the fat of butter. So these are the kinds of things we talk about. And everybody says, well, eat less white stuff and eat more of this and more of that. Nobody says you have the tiniest speck cross-contaminating your food and you will be sent to your room for days. So pain does not fall down from the sky. Most of us are worried our back's going to go out if we do something wrong. Your back didn't go out. It's what you ate last night that made your back go out when you picked up a Kleenex at 10:30 this morning.
Hmm.
It's most
So interesting.
If you have pain in the morning you didn't have when you went to bed last night, and you don't remember sleepwalking and getting hurt last night, it's almost always last night's food. And it's on the do not eat list. And you could have made a better choice.
Mhm.
And your body sent you to your room, and you're going to go and get a surgery for that? Because you don't understand that it's not coming from your disc. And you don't understand that everybody's telling you that disc they see on your MRI is significant, and I'm telling you it's not. Discs don't do that, except every once in a blue moon. And every once in a blue moon, there's success like that in surgery. My mother is one. She bent over and hit the Kleenex. She ate food like that all the time, so I don't know that one night was different than the other. She had a herniated disc, pain going down her leg. The disc was removed. She was up walking the next day and never had pain again in her life. Everybody knows the story of that every once in a while. But most of us, the only thing you can believe is what you can touch and feel. Where are you tender? And did the surgeon ever really touch you?
Hal, give me a few minutes on what in your youth or what in your pre-medical school or even maybe even pre-college days. I know a little bit about your history and the bumps and bruises you took in order to become where you are, but how about if you give our listeners a little ride of how does Hal Blatman become this unique doctor figure that you've become over time? What happened to you?
You know, I was always encouraged to figure it out. And I could have gone into other things besides medicine. Medicine showed itself, and my prime directive in high school was I wanted to never be bored. And I spent a lot of time in high school bored, really
Mhm.
bored.
Yeah.
And I didn't want to spend my life that way. And I realized that there'd be enough stimulation in medicine that I could find something I liked and I would never be bored. And I wouldn't necessarily be wealthy, but I would always have food on my table. And that kind of got me to cross the line and gave me the drive to do it. And I'm actually in my 4th career since I
Yeah.
graduated medical school. I evolved from one to the next. And I think what drove my bus was that I hurt my lower back on the Nautilus low back machine in the 1980s. And I had 2 years of orthopedic surgery training behind me. And I was reading this orthopedic journal a few days after I hurt myself. And the doctor was talking about physical exam techniques you could do to tell that the patient was faking. And as with low back pain, that's a big deal in medicine.
Yeah.
And I realized at that moment that I couldn't pass the test. This guy would think I'm faking. And I had not yet my first pain-free moment. I was that miserable. And I realized at that moment that all these people that were writing articles about pain, none of them had a clue what they were talking about. And none of them had ever hurt their back. And none of them had any idea. And I knew I didn't either. My orthopedic training steered me astray like it steered everybody else astray. And it wasn't just orthopedics, it's all of medicine, all of physical therapy, all of chiropractic. Not all of, but most of. And I went on a search to figure it out. And I figured it out little by little. But I'll tell you, if I had known 30 years ago that gluten and dairy played such a big part, I would have never learned the rest because I would never heard enough to figure it out. And as I did trigger point injections and felt better, I knew that was a big piece. But then when I started to regrow tendons and make tendons stronger and fix the anchors, the trigger points didn't come back. And as I fixed the food, I did even better. And I'll tell you, it's been a tremendous journey. The last thing I took out of my diet was 4 months ago. And I am so much better now than 4 months ago. It's, again, another transition because, as you might know, you never know how much you hurt till it doesn't hurt anymore and the pain is gone.
So true.
And every step of the way, I thought I was like so much better. And gosh, is this nice? But I still hurt. And every step is just that much better. And I made my most recent step 4 months ago, and I started this journey 25 to 30 years ago. So I'm learning it as I go, as fast as I can, and I teach it to everybody I can show it to.
So, of course, Hal, we got to know what was the thing that lasted until 4 months ago.
Goat, sheep, and buffalo cheese.
Goat, sheep, and buffalo cheese.
Now, you're not going to feel it if you're still eating cow cheese. You may not feel it if you're still eating gluten. You may not feel it if you're still eating sugar. But I took that out of my diet, and I'm a world better.
Fascinating.
My golf game is so much better.
Your golf game's always been pretty damn good, Hal, just to let you know.
The last few years, it has not been that good. But I just bested my best game by 7 strokes the other night.
Wow.
Because I can move and I can turn and I don't hurt.
Wow.
And it's really fun.
Yeah.
Got to admit.
Yeah.
And everybody can do it. This isn't magic. It doesn't take a lot of money. So we're going to show videos on how to work on your partner and how to spread the word and how to make this count. And if you have a really difficult problem, you can make it to Cincinnati or Manhattan, and we can start to help work on your body and help to restore it. And as quickly as you restore, a lot of this pain can go away.
So you mentioned Cincinnati and Manhattan. That's how people run into you live. And if they're going to get access to you, is this the BlatmanHealthAndWellness.com? Is that where they naturally go? And then is that where they can connect with you?
Yes.
Okay.
And that's where you'll find our contact information. That's where you can come. You can learn a lot about what we do. We even talk about stem cells and PRP. There's a lot of things that we don't talk about on our website because we don't want to talk about them on our website, but you'll learn about them when you come.
Interesting.
Yeah. So don't think that because you don't see it on the website that we have no knowledge of it.
Exactly. Yeah. It's a funny industry, isn't it? You have to be a little bit careful at times with what you say inside of our industry. And it sounds like you know that. I certainly know that from a psychiatric standpoint.
Yes.
Hal, as usual, an amazing conversation. So I really appreciate you. I love you dearly. And I want to ask you if there was one more thing that you felt the general public, look, you've already said many of semi-shocking things, if not truly shocking things about food, about gluten, about even alternative cheese like goat, sheep, buffalo cheese, and every bit of dairy, including butter. And then not to mention bananas and mashed potatoes and these kind of things, and that it all comes from food in many ways, as well as past injuries. And you've made several, claims here that I firmly believe to be entirely true and way more sensible than anything I learned in medical school. But now I'm asking you one more piece, which is, what do you want to tell everybody? If they have one thing, what do you want to tell the public about either who you are or who they are or what life's about? Is there one thing that you can synopsize or summarize that you would want to tell each and every person out here?
The reason I go to New York is because my son told me years ago that if I really want to change medicine, I'm not going to be able to do it from Cincinnati. I'm going to have a much wider exposure. And I'm not going to be 90 years old and wonder if I could have. I'm going to be 90 years old and know that I gave it everything I had. So if I can do anything and ask people to help, it's going to be to spread the word to help mankind get out of pain. Show the world that there is a way and that there is somebody who knows some of the answers and can help point us in the right direction and get us going, because there's people who are going to come after me that are going to learn even more. And I didn't make this up. I learned this on the shoulders of greats. I was mentored by Janet Travell, who was one of Kennedy's physicians in the White House. I did not come upon this on my own. I learned a lot on my own. I figured a lot of it out that hadn't been figured out before. But there were a lot of shoulders I stood on that were great people and still are great people in my memory.
Love it. Hal, wonderful conversation. Thank you so much. And it's really been a pleasure. And for all of you who've stayed on for this show, thank you for being here. This is my buddy Hal. Hal and I grew up. Actually, we didn't grow up quite close.
We grew up as young adults. That was actually growing up
young adults,
together. There's no question, Fred.
No question about that. We definitely did that. And it's always been a pleasure. It's always a thrill talking and interacting with Hal. And I hope you've enjoyed it as much as I have. And if so, I'm going to ask you to either comment or share or maybe even subscribe to the Healthy Healer, and make sure that you visit Hal at his website. And if you really want the help that I've received in the past with trigger point injections and other forms of treatment that makes a lot of sense but isn't what we were taught, check them out at BlatmanHealthAndWellness.com. Hal, thanks for being here. It's been lovely. We'll catch you on.
Fred, thank you. Be well.
You're welcome.